Hi, we're going to do the reproductive system. I'm only going to talk to you about a few things on the slideshow, but we're going to talk a lot in class about this. We all know that pregnancy results from the union of the ovum and the sperm, usually in the fallopian tube that occurs, and then that fertilized egg travels down into the uterus and implants itself. The growth of the offspring takes 280 days or 9 months to fully mature. When that egg is fertilized, it's known as a zygote for the first 2 weeks after conception. As a blastocyte, it later implants itself in the uterine wall and is considered to be an embryo through the 8th week. That's 2 months into the pregnancy. From 8 weeks to birth, the unborn baby is called a fetus, and during the first 30 days of life, the baby is considered to be a neonate. This is a very old slide that I have, but I always throw this in here because I think it's so interesting. You can see from the period of the zygote dividing on through as the baby develops through 38 weeks. And you can see within the 3rd week of that fertilized egg developing, already the central nervous system in the heart, if you look down column 3, is developing. And in that darker blue section, in the 3rd week, the 4th week, the 5th week, and a little bit into the 6th week, you see the ears, the eyes, the heart, the arms, then the legs are developing. And that's when that dark blue shaded area, those 3 weeks, where that fetus is at very high risk. If anything was to be ingested by the mother or if she was exposed to something, it could affect the development of those organs. And then as the baby continues to develop, the heart, the arms, the eyes, the legs, the teeth, the palate, the genitals, the ears, you can see the areas where there's the most concern. And for the most part, it's within the first 2 months that anything that could harm the baby could really have an impact. And the importance of that is many people don't even know they're expecting a baby until they're a month and a half, sometimes as long as 2 months in. Before they realize that they might be pregnant. In the meantime, they might be drinking, taking strong cough medicine, following up with regular medications that they're on, and all of those things can lead to abnormalities. And when you think about how fragile those 38 to 40 weeks are, as far as the systems that are developing and how vulnerable that fetus is, it's amazing when a baby's born without complications, given that the beginning of the pregnancy, when people don't even realize they're pregnant, there's so much key development taking place. So that just gives you an idea of when things are developed and when those little fertilized eggs and fetuses can really take a hit if they're exposed to anything inadvertently or advertently. So what most people don't know is there's 3 stages of labor. The first stage is the muscle contractions when the uterus contracts, and it causes the amniotic sac, which is the fluid sac around the baby, to break. And the cervix, which is at the base of the uterus, starts to expand, and expands to 10 centimeters. And if you can imagine about the top of a coffee can, that's about how wide the cervix will stretch. The uterus will actually stretch 500 times its size during pregnancy, but those that organ can contract back to its original size, like a balloon, like when you stretch a balloon and then it can go back to its own size. So as the cervix dilates, it allows the fetus's head, which babies should come out head first. If they don't, that's called breech if they come out feet first. But the head should come out first, and that's the first stage of labor. And then the second stage of labor is the actual delivery of the baby. And then there's a 3rd stage, and that is the delivery of the afterbirth, or the placenta, which starts out as a thickened uterine lining and ends up being the vessel of nourishment for the baby while it's developing. And so about 15 minutes after a baby's born is the final stage of labor, the 3rd stage of labor, and that is the expulsion of the placenta. It's really important that all the placenta comes out. I think I might have talked to you about this in class. If not, I'll mention that they actually check the mother continually for many hours after birth to make sure that there's no indication that bits and pieces of the placenta are still being expelled. It should come out in one piece, because mothers will hemorrhage The body's natural reaction is to contract the uterus and increase bleeding to get rid of any placenta. And that's why you hear about women who die in childbirth. Many times, especially back in the day, they actually hemorrhaged to death because the full placenta was not expelled when the afterbirth was all coming out. So growth and development. We're going to talk more about this, but growth and development. Growth refers to the changes that can be measured by height and weight as the changes in body proportion occur. And development describes the stages of change from a psychological and social function. So there's growth, physical growth, and then there's the psychological and social growth and development. When you have a new baby, I guess these are all assessment techniques that can be with any mother that is carrying a baby, and some of these are just regular gynecological exams. So palpation, most of the disorders of the reproductive system can be assessed by palpation, by pushing and feeling around on the abdomen, sometimes inserting a speculum vaginally and checking the cervix manually as well, checking the vaginal opening. There's a cystoscopy, which can be, you can see some of the reproductive organs if you scope the bladder and check. You can see the ovaries that are on either side and some of the uterus too. The PSA test, or the prostate-specific antigen test, is a fairly new, in the last maybe 20 years, a blood test to measure men for prostate cancer. So of course, if you look at statistics in the last 20 years, the incidence of prostate cancer has gone way up. But it's because more are being diagnosed earlier because of this blood test. And pap smears, where they actually insert a long Q-tip into the vaginal opening and get a sample from the head of the cervix of the tissue, wipe it on a slide and look to see if there's any precancerous or cancerous cells, and that's a pap smear. A mammogram is an X-ray technique used to visualize breast tissue. Men and women get mammograms because men and women can get breast cancer, believe it or not. Amniocentesis is a procedure where a needle is introduced through the abdomen to withdraw amniotic fluid from an expectant mother. And they remove that amniotic fluid, and they can do genetic testing and testing for abnormalities too. And they can withdraw that fluid without interrupting the pregnancy, which is pretty amazing. Ultrasonography, you guys have all seen sound waves. Sound waves work very well to visualize a baby because the baby's surrounded by fluid. And if you got a chance to shadow an ultrasound, you know that the fluid bounces off the sound waves and you get a really good image. And then the CVS, the chorionic villus sampling, is when they actually take sample from the umbilical cord to see if there's any abnormalities with the baby as well. Benign prostatic hypertrophy is an age-associated condition with men. Their prostate grows and gets stiffer, and it causes a lot of urine blockage. So older men often complain that they're not able to urinate in an even flow, that it kind of stops and starts. Somebody once referred to it as Morse code. But anyway, that's a problem with older men, and then it can cause a lot of interruption in their daily living and could make them feel like they have to always go to the bathroom and they get up 10 times in the night and that kind of thing. Cancer of females, in their reproductive areas, breast cancer prevalence is high. The lining of the uterus can actually start to mutate and cause cancerous cells to form, and cervical cancer. And so you guys, for the most part, probably have gotten the HPV virus, which will prevent, hopefully, cervical cancer in your generation. There can be testicular cancer, and much like breast cancer, self-examination is very important for that. And I know when there were the outbreaks of cancer around Southside High School back about 15 years ago, testicular cancer was one of the cancers, one of the unusual cancers that was occurring in the area. Another disorder can be a chancre or a chancroid, and that is a bacterial infection that is like a cold sore of the genitals, and that is contagious. Chlamydia, which our case study person had, is the most commonly sexually transmitted disease and often does not have symptoms. And men almost never has symptoms. So it can be passed around and people don't know they have it and they can spread that disease. Cryptochiasm is something that is detected in newborn or very young male children, and that is that the testicles fall into the scrotal sac before birth, but sometimes that doesn't happen. One might not fall or both might not fall, and so they have to bring that testicle down so it can develop in the scrotal sac outside of the body so that they can produce sperm eventually that are viable. If the testicles stay up in the body, then it could render that little boy child to be sterile or not be able to have children. An ectopic pregnancy is different than a pregnancy where the fertilized egg implants in the uterus. An ectopic pregnancy, that fertilized egg implants in an unusual spot, and it's not conducive with a fully developed baby growing. Oftentimes it's in the fallopian tube itself, and the fallopian tubes are not very big, maybe as wide as your pinky finger. And so if a fertilized egg develops in there and starts replicating and becomes a fetus, that fertilized egg is not going to survive there because there isn't the blood supply and there also isn't the space. So unfortunately, for some people who have these ectopic pregnancies, those tubes can rupture. And if you lose a fallopian tube through an ectopic pregnancy, then it lessens your chances of getting pregnant by half, which is a situation. There's a condition called endometriosis where the tissue in the inside of the uterus starts to show up outside of the uterus. And it can be painful and cause all kinds of, it's like having scar tissue in another part of your body. So that's not a good situation, and it often has to be removed, and it'll grow back sometimes. It's a difficult condition to deal with. Erythroblastosis fetalis is a condition that can develop when the Rh positive fetus of an Rh negative mother, and those are the blood types, develop antibodies against the Rh blood protein. So that is a condition that we watch for, and when mothers and babies have different Rh factors, the babies are given an injection so that they don't end up with that. Fetal alcohol syndrome. When a mother uses alcohol during her pregnancy, it can cause physical and mental defects in children and mental delays and stunted growth and that kind of thing. There can be fibroid tumors that are found in the uterus. Again, that's tissue that's always changing, and so it lends itself to tumors growing there. Genital warts, or the human papilloma virus, is another thing you guys are being vaccinated against, but genital warts are highly contagious, and if you get them, they're almost impossible to get rid of. So you definitely want to make sure that you're always practicing safe sex, and also there's some other things that we'll talk about when we get into birth control about what people can do to prevent that genital wart transmission. Gonorrhea, bacterial infection, and one of the most prevalent sexually transmitted diseases. In fact, we've learned that when they treat you for chlamydia, they'll treat you for gonorrhea too, just because the two often go hand in hand. Herpes simplex is also a very common sexually transmitted infection, and that is also one that is a virus that stays in your system and causes flare-ups throughout your life. The human papilloma virus is an infection that does not cause any visible symptoms but can lead to cervical cancer. And again, they say it's not a question of if you'll get it, it's when you'll get it, unless you've been vaccinated. Klinefelter syndrome, we're not going to worry about too much. In our case study, there was a symptom of leukorrhea. Leuko, white blood cells. Leukorrhea is a whitish vaginal discharge, and that could be an indication of a sexually transmitted infection, a pH imbalance, or maybe some other cancer things could be going on. There's a whole bunch of menstrual disorders that can happen, and if ever there's an inflammation of the testicles, it's called orchitis. PID is associated with gonorrhea, chlamydia. It's pelvic inflammatory disease. Is just kind of a global term for a sexually transmitted infection. Phimosis is the narrowing of the foreskin of the penis, and that sometimes has to be surgically corrected shortly after birth. PMS, or premenstrual syndrome, is a hormonal imbalance that happens prior to people getting their periods, and it can